All right, so today we're meeting with Greg, who just had some problem with his right shoulder, osteoarthritis. I'm going to be demonstrating how to apply biphasic pulsed current, specifically the normal or high frequency TENS is the application that we're going to be doing. Some of the indications of that fit this patient are osteoarthritis in that right shoulder joint, and he has a considerable amount of pain. Some of the contraindications that I would be concerned about are whether or not he has a pacemaker, there's any cancers in the area, any loss of sensation, or if it were female, I would ask about plans, or if there is a pregnancy, if we're working in the torso or low back. So the purpose of this is to stimulate the A beta nerves to help reduce pain via the gait control theory. And so that's my plan. I'm going to start working with the patient. Hi Greg, my name is Josh. I'm a doctoral student of physical therapy under the direction of Dr. Clausen. You're coming to see us with some right shoulder pain, some osteoarthritis that you have there. And so what I'm planning to do today, what I think would be a best fit, is if we did some high frequency TENS, electrical stimulation of the shoulder. Basically what that should feel like is it should feel like a light tingling sensation. It should be very comfortable for you, and it should help to reduce that pain afterwards. Is that all right by you? Okay, in order to do so, I'm going to need to place my hands and some probes on that shoulder. Are you comfortable with that? Okay, the treatment's going to last about 20 minutes. You shouldn't feel any pain, some light tingling, and if you do, I'm going to be right here, and we can change the parameters of the treatment there. Do you care if I inspect the skin on your shoulder just to make sure everything's intact? You haven't had any surgeries here, have you? And can I ask, do you have a pacemaker that I need to be concerned about where we are sending electrical stimulation through the shoulder?
No.
Okay, sounds good. So let's go ahead and set up the parameters here, and then we'll get going. If you wouldn't mind holding this for me. Alrighty, so first off, I'm going to turn the machine on. I'm going to come here to biphasic pulsed current, and since we're doing high frequency, I just want the on-off ratio to be continuous there. Then I'm going to come in here to rate and duration, and I'm going to bump my pulse rate up to 90 pulses per second, and then I'm actually going to bring my pulse duration down to 100 microseconds here. So this is going to take a little bit.
Great. So I think when you started there, and then you'll feel that turn on, and I just want you to kick your leg up instead of stride.
So there I'm set at a rate of 90 pulses per second, with a duration of each pulse being 100 microseconds. I'm still in a normal treatment type, no co-contractions or reciprocal, under continuous, and I have a ramp time of 0.5. Then I'm going to come in back to, I'm going to bump my treatment time up to 20 minutes here. And then the intensity that I do, I'm going to first put the pads on the patient, and then I'm going to increase the intensity until the patient is comfortable with a light tingling sensation over the concerned area. So we're going to come up and we're going to take the electrical stim pads and we're going to place them on Greg's shoulder here across that joint line. Make sure those are good and secure. And then we're going to go ahead and come in here. All right, Greg, I just want you to tell me when you have a comfortably light tingling sensation of that of the area between those two pads. Okay.
For Nmes. Oh yeah.
You starting to feel it there?
My muscles twitching.
Muscles twitching. Okay, we'll bring that down just a little bit.
It's funny, I don't feel anything.
You don't feel anything?
Yeah.
Until the muscle starts to twitch? Okay. We can adjust the patch just a little bit here. We probably landed right on a motor unit, and so we're recruiting right when the motor unit starts. So let's go ahead and try that.
Oh, yeah, just, yeah, and then you actually just push it down.
So to get started, I have it on 5 phases.
Any tingling sensation?
Very, very faintly.
Very faintly.
It's at 200.
Yeah.
Is that comfortable right there?
Yeah.
Okay.
That's good.
So then we would sit here and we'd let that run for about 20 minutes. We're gonna continue to check with the patient to make sure things are comfortable. And then, so we're gonna let this run just for a couple seconds. We're not gonna do the whole 20 minutes. That'd be a long video for you to watch, Dr. Clausen. So, again, the sensation there is just gonna be light tingling. We shouldn't have any muscle contractions. And basically what we're doing is, to explain to you, we're stimulating what's called an alpha, or an A beta nerve. And what we're trying to do there is we're trying to send a whole bunch of signals of tingling to the spinal cord and to the brain. And we're basically trying to send more signals than the brain can take, because right now you're getting pain signals and you're getting tingling signals, right? So by sending more tingling signals than pain signals, we're kind of overwhelming the brain with those light tingling signals so that you're not experiencing that pain. And that should also help to calm down the pain signals, so that after the treatment, you're also not receiving as many pain signals to the brain, allowing you to be pain-free.
Okay.
Alrighty, and then we're gonna go ahead and stop, and then we'll remove the treatment, and then we'll assess the patient's skin and ask them how the treatment went. Did that stay comfortable throughout? Did we need to change anything there?
Yeah, no, it felt good.
Okay, and then I'm just gonna go ahead and assess the skin, make sure we didn't cause any burning or irritation. And that was how I would apply the high frequency TENS using biphasic pulse current.
The muscle fired.